Hi, everyone. I'm Dr. Antonella Rivera. I work for the Coral Reef Alliance as principal investigator for the MAR region. Today, I want to tell you about the impact of sanitation best management practices on human and coral reef health. This work is a collaboration between the Coral Reef Alliance, the Bay Islands Conservation Association, Healthy Reefs for Healthy People, and Polo's Water Association. I will turn off my video so you can see the slides better. So let's start by talking about the Mesoamerican Reef region, or MAR. The Mesoamerican Reef is the second largest barrier reef in the world. It stretches almost 700 miles along the coast of Mexico, Belize, Guatemala, and Honduras. And over 1 million people depend on this reef as a source of livelihood. However, according to the IUCN Red List of Ecosystems, the MAR is critically endangered. It is increasingly clear that nutrient pollution is a key threat. Years of data have shown that fleshy macroalgae has nearly doubled over the last decade. Macroalgae interferes with coral growth and recruitment, thus reducing reef resilience. The abundance of macroalgae can be attributed to two types of controls: top-down, due to reduced herbivory, or bottom-up, which includes pollution from coastal waters with excess nutrients. Now, this poses a risk for both human health and coastal livelihoods. However, there is little research linking the role of sanitation best management practices with these aspects. So what are these sanitation best management practices I keep telling you about? You probably are aware or know about what best management practices are. These are on-the-ground solutions to pollution problems from many sources and sectors. These sectors can be anything from forestry, agriculture, urban development, etc. Now, to be a best management practice, you need three key elements. One, that you provide prevention measures, that these measures are defined and explicit, and that they're based on research and experience. So for us, sanitation best management practices are proven, locally tailored measures to target water pollution problems. And talking about these practices, we want to tell you about a case study in Half Moon Bay, which is located in the Bay Islands of Honduras. So to carry out this study, we collected data on three fronts. First, we collected information on governance going back to when this process started in 2005. We worked on systemizing local ecological knowledge through interviews and focus groups. Now, this required on-the-ground work with the key stakeholders who have been here along the entire process, and to build relationships with them so we can have trust and have clear and adequate data. We also use data on reef health, which is collected every 2 years for over a decade by Healthy Reefs Initiative and many local partners. Now, they collect numerous variables, and among these, you can find coral cover, macroalgae cover, and coral disease. Specifically in Roatan Bay Islands, they collect in 25 sites, 3 which are near the sewage treatment plant. Finally, we use data collected by the Bay Islands Conservation Association, which is an environmental NGO working in the Bay Islands since the early 1990s. So they started this type of water quality collection in 2013 when they saw that there was a lot of water pollution in urban areas. They collect physical, chemical, and biological parameters, and they've been so successful with this that in 2015 they expanded to another Bay Island, Utila, and starting this year, we are all part of a regional water quality monitoring project in the MAR. So what did we find? This is a general timeline of the process of getting to sanitation best management practices in Roatan. It has been a long process which started in 2005 with a dissatisfied community that needed a change, up to 2020 where they have a strengthened and growing water board. Let's look at this timeline in more detail. In 2006, Polo's water board is first established. By 2009, they acquire their legal status. In 2010, they install micrometers which help build trust and transparency. By 2012, they construct the wastewater treatment plant, and in 2013, they open their customer service office. In 2015, they continued to grow, and then in 2017 to 2018, they begin this collaboration with PICA to have water quality monitoring. Now, this data generated by this monitoring has been key to building buy-in with local stakeholders, to helping people see why the wastewater treatment plant is important and help everyone work together towards a common goal. In 2019 to 2020, they revised the management model, have an assessment of the plant, and they improve their infrastructure. Now they currently have solar panels installed. As you can see, this process to sanitation best management practices isn't only about infrastructure, even though it's key, but also about building trust and transparency with the local stakeholders. So, have these sanitation best management practices worked? Here we have a graph of average enterococci concentrations per 100 milliliters. Basically, bacteria in the water. Each colored bar represents the concentration of enterococci per year, starting from 2013 up to 2020. The solid yellow line is the number of connections to the wastewater treatment plant. By 2020, 99.65% of accessible homes were connected to the wastewater treatment plant. And the dotted yellow line represents the Cartagena Convention limit. So this is also a long process, but by 2017, they're already seeing changes and they've already met the Cartagena Convention limit. In fact, numbers after this start going down. And this was so successful that the area of Half Moon Bay was awarded a Blue Flag Beach Award. So we're seeing that sanitation best management practices are really key for human health. But what about coral reefs? Here you have data from Healthy Reefs Initiative on percent of coral disease. If you remember, connections began in 2013. So before connections in 2010, percent of coral disease near the wastewater treatment plant ranged from 15 to 25% in corals. By 2016, this had gone down to 0%, and it's remained at 0 till 2018. So we definitely see that sanitation best management practices are having an effect on coral reef health. Now, all management must be adaptive, and we need to be able to respond to changes. For instance, in 2020, the Bay Islands were hit by stony coral tissue loss disease. We are cautiously optimistic that the sites near the wastewater treatment plant will be okay because of the healthy water that they have. However, we will not have this information until the 2022 Reef Health Report Card by HRI. So what have we learned from our case study? First and foremost, wastewater treatment plants work, and they're a cornerstone to having sanitation best management practices. But they aren't the only important thing to consider. We also must include stakeholders in every step of the process to generate transparency. And understand that it takes time to implement these practices, and we need to be able to build trust first. Finally, sanitation best management practices are an adaptive and iterative process. This never ends. We always need to be able to respond to changes and locally tailor our solutions. If we've learned one thing from the Half Moon Bay case study, it's that sanitation best management practices are key for both human and reef health. If you have any questions, please don't hesitate to contact us. Thank you for your attention.